We're very lucky to have with us live in the studios this morning Joanne Woiak. Joanne Woiak is a lecturer in the Disability Studies program at the University of Washington. She focuses on the history of biology and medicine, including the British eugenics movement and sterilization laws in Washington state. So it's an extremely intriguing topic. How did you get interested in it in the first place?
I've been studying history of eugenics since grad school in the 90s, which is actually because of my supervisor who did British eugenics, got me interested in this. And, it's actually coming from a background of starting out being interested in pre-med and studying biology and medicine per se, and then realizing, actually, the chemistry classes are not so appealing, don't do so well in those. So I actually moved to history of science, history of medicine, where you get to look at the scientific ideas in their social cultural context and really think about what's the interaction between ideologies and values and politics and economics and where our modern knowledge claims and technologies come from, that they don't just, emerge and exist in a vacuum. They're used for things. They come from people who want to use these ideas for certain things. And that one place that led me to was thinking more and more about genetics and the long history of genetics and why we're so, infatuated almost with looking for genetic causation of everything about human beings. Goes back to the late 19th, early 20th century and the eugenics movement. So I was actually looking at Britain as a grad student, which was a good excuse to spend long lengths of time in London doing research, basically. And then came here to Washington in 2001 and in Seattle and started thinking about, how about doing some American history of eugenics? And as far as I know, almost nothing's been published on Washington State eugenics. So started thinking about that. Actually got started maybe about 2007, 2008. I've been teaching as a lecturer in the Disability Studies program at University of Washington. And we were contacted by a colleague who's a law professor, I think at Georgia, Paul Lombardo, about starting to do a public history project and some more archival research and so on about the Washington eugenics movement, Washington sterilizations, forced sterilizations here. And what he was thinking about was that Lombardo's been involved in getting apologies in various states across the country from legislatures and governors who have been thinking about, sort of the state's role, top-down form of eugenics, how the state passed, all states across the country were passing all these laws. There were about 30 states, in fact, that had forced sterilization laws, surgical sterilization, so people couldn't have kids. So he had been involved in actually getting apologies in 5 or 6 states since 2001 at an official level. And then he'd also been involved, Lombardo had been involved in organizing some academic conferences, which I think is a form of public history, not just writing for your fellow scholars, but taking it out there where the general public and affected communities can learn about the past, but also have a dialogue, have some sort of input, into forming a collective memory of what happened in the past and how it really influences them, what it means to them, not just to us as scholars, hopefully a bit of a back and forth. So Lombardo was trying to push us, to do some of these things in Washington that have happened in Indiana, California, Virginia, the Carolinas, I think, did these apologies. So that went to my colleague Paul Miller in the Disability Studies program, who's also a lawyer. And then he was talking with me, and by 2008, we were starting to think about this, about doing a big event, getting some research going, maybe forming some alliances with disability advocacy groups who might be interested in getting some sort of apology movement going here. But it hasn't happened, but we've been in touch with folks. So that's some of the background of what's been going on and how we got this conference going that we had just this past fall.
In October at the University of Washington.
Right, yeah.
And how I heard about you, because you put the whole conference together.
Yeah, I'll ask you later. I'm still wondering how you heard about it, what the grapevines were, because I sure did a lot of advertising for that. I did a lot of outreach to various communities and the press, really in the hopes that this would get a lot of public attention. And we did. We had, the conference had seating for 200 at that big auditorium in UW, and we the registration filled up. I mean, maybe we had 100, 150 people there. It was great. And a lot of folks from various aspects of disability community, disability rights people, but also a lot of academics from a lot of different fields, as well as the speakers. I brought in colleagues from a lot of different fields, both local folks at UW, Steve Jones, who's at Washington State University, and then folks from the East Coast came in, and we combined that with some people from the disability advocacy community, Disability Rights Washington, ARC of Washington State. So I think it was a good mix of scholars and non-scholars and different disciplines represented, and got a lot of different perspectives and great audience participation. I thought it was really a very effective event. So I'm glad that you're helping to continue to help me get the word out and promoting this event, because I think it's important for people to be thinking about this past and what it still means today.
And there is a website where that entire event was recorded and people can go to, which is eugenics.washington.edu.
That's right.
Okay.
That's right. Yeah,
So
we got that set up at University of Washington, and folks should look for continuing development to that website, actually. Yeah, we'll be putting more and more content on there, and hopefully have some content for educators and for students, and there'll be some original research on there, and there'll be links to materials about the history of eugenics throughout the country. So a lot of opportunity to put stuff on that site. Yeah.
So I want to get to specifically what happened in Washington State, but I think to do that we should start out, if you can kind of give us a brief overview of the history, some of the history of eugenics, and perhaps define it as well.
That's a good idea, yeah, since we started out using the word eugenics, which was taken from Latin words for to be well born, good in birth, and that comes from 1880s Francis Galton, who was Charles Darwin's cousin. And Galton was kind of thinking about, well, there's this new evolutionary theory is out there. And Galton was actually very odd for his day, where he was very early on convinced that heredity was the answer to everything, right? Anything interesting about humans must be in our biology, must be in our genes. They didn't even call them genes yet in the 19th century, but he was really cutting-edge hereditarian, Galton, and came up with, or formalized this idea of people should be well born. So by the turn of the century, by 1900, 1910, in the United States, there's a formation of a really organized eugenics movement, which was a branch of science. It was cutting-edge human genetics that really had a social agenda. It was a social reform movement based in science. It was considered progressive, forward-thinking. There were liberals and socialists. This wasn't just totalitarians and ultra-conservatives. This seemed like a good idea that we're going to use modern scientific knowledge and improve the human species. It's about improvement. And on the face of it, to be well-born, yeah, of course. Who would question that? But you get into the nitty-gritty of, whose standards of well-born, whose standards of what's improved. What were they really aiming for? They were aiming for basically a pure white American race, right? I mean, they used terms like degeneracy, as we were talking about, that anybody who didn't measure up to good middle-class white standards was a degenerate. If you were a pauper, if you were poor, if you were criminal, if you were worked as a prostitute, if you were alcoholic, if you had any kinds of disabilities, but especially mental disabilities, that was all this lower form of human being. And from the late 19th century, there was more and more consideration that it seemed like the progress, the evolution of the human race was maybe going backwards, that the people who had the undesirable traits were having too many kids. So what do we do about that? They called it negative eugenics. Let's prevent the unfit from having any more kids. Positive eugenics was, let's encourage the fit people to have more kids, right? The white middle class people in particular in America, so that we can sort of purify our population of all these degenerate elements. There's obviously a racist aspect to this in some parts of the country. It was very, very sexist, because usually these policies were targeted at women who were seen as, the bearers of the future generation. So probably 2/3 of the folks who got forcibly sterilized were women. And certainly you have to think of this in terms of people who were labeled as having disabilities, that they were above all the folks targeted as the unfit. folks who'd already been institutionalized for various reasons, who were committed to the mental hospitals or to these other state facilities that were called, in Washington, we called them custodial schools. Originally, it was called the feeble-minded school. It was at Medical Lake. And then that branched out, and there's a second one now at Buckley, the Rainier School, which still exists. So that was the basic idea of eugenics, right? That we need to improve the quality of the human race, the assumption that most traits are inheritable, and all we need to do is prevent people who have the bad traits, the bad genes, from passing those on. And it was really strong focus on costs. You know, that why should the taxpayers have to pay for the institutional care of all these disabled folks? Why should taxpayers have to pay for people who are in the poorhouse and in prison and that sort of thing, right? Isn't the ultimate solution just to not let any more people like that be born? And again, I think there's some continuity with thinking about costs and resource issues in the modern day. You know, what are we willing to put our resources into?
So Washington State was one of the first states.
Right. Yeah, that's what I should have said at the beginning, that the reason we were, Lombardo and my colleague Paul Miller and I were thinking about doing an event in 2009 was to mark the centennial of our first forced sterilization law in Washington State. Our first law here was the second law in the country, the second law in the world, that said doctors, surgeons, superintendents of these institutions could pick and choose who deserved to be sterilized. And just, you know, they took a vote. It was called the Institutional Board of Health here, which consisted of the state director of health, you know, kind of the DSHS to the modern day, and the heads, the superintendents of these institutions, these mental hospitals and custodial schools would all get together. And they'd see case after case of somebody who's, you know, the doctors and the institution said this is a person who probably shouldn't have kids, and took a vote and said, yep, let's just forcibly sterilize these folks. Now, actually, having said all that, I should back up and say we were the second state that had a forced sterilization law, but I need to qualify that and say that 1909 law was actually not targeting the folks who were in the mental hospitals at that time. It was actually targeting what were called habitual criminals. Okay, so there's a little bit of a twist here, where the 1909 law, it was eugenics. It was saying it was called the law for the prevention of procreation. You know, they were thinking about habitual criminal. They were the categories were habitual criminals, convicted rapists, and people who'd been convicted of sexual abuse of a child under 10 or something like that were the specific categories. So they were thinking, you know, probably the reason that these people exhibited these behaviors or were convicted of these behaviors was some sort of genetic basis, so best not to perpetuate those genes. But it was also clearly intended as an extra kind of punishment, right? So that was actually, you know, it was a eugenics law and more, but it's still on the books. It's still there. Maybe almost never used. That's still unclear to me. We need to do some more research. I've come across some colleagues who said maybe 2 or 3 people got sterilized under that law, but other than that, not so much. So we were very early in Washington State. The first sterilization law, forced sterilization law, was Indiana. That was 1907. Then was us. Then California, and I think Connecticut in 1909. California, in the end, sterilized 20,000 people total from 1909 through the 40s or 50s. We sterilized, the official total here is 685 people, 685 in Washington State. And now that total comes from the second law. So we passed a second forced sterilization law in 1921, and that expanded the categories of people who qualified for sterilization to include what was called the insane, the feeble-minded. That was a term of the day, right? That was sort of the catch-all phrase for what we now call intellectual disability. epileptic, and then all these categories of sort of sexual perverts, moral degenerates, those sort of categories, and criminals were still in there. So they were sort of expanding the definition of who was genetically unfit to include these other categories labeled as disabilities in 1921. So in that 1921 law, we sterilized a minimum of 700 people. The record keeping very sketchy from what I've seen. I know that at the symposium, Mark Largent, who has written a book, sort of doing an overview of all the sterilization laws across the country. I think he was saying at the symposium, the real numbers of people sterilized was at least twice that many, probably more. The total for the country, the official total is about 60,000 people that American government, state governments sterilized in this country in at least 30 different states, and probably it's much higher than that. Same thing here. You can see even the superintendents of the mental hospitals, they were sent these letters. You see them in the state archives. They were sent letters from the National Eugenics Organization asking, okay, how many folks did you sterilize this year? Because they wanted to, keep these running totals. And I think in a sense the states were competing with each other to see how effectively they could implement these laws and improve their populations, right? So the superintendents respond to these letters and say, well, I'll go ask my doctors, let's see if we can get some numbers. And the numbers would just be skewed all over the place, different tallies all the time. So it's really hard to say. You also see in the records that they would tabulate how many people had sterilizations, which were defined as getting your salpingectomies, getting your tubes removed, your fallopian tubes, or having a vasectomy. Those were recorded, but they also recorded tons and tons of women in the mental hospitals who would have a hysterectomy or have their ovaries removed. And those didn't even count as sterilizations, right? So there's this official sterilizations under the law, but they're effectively sterilizing, preventing from having kids, lots and lots more women during this time period. And then probably it's worth noting that the practice ended in 42. Most of the sterilizations in Washington state took place between 1936 and 41. And that probably is because it coincides with the Great Depression and more concerns about how much does it cost us to institutionalize people and how can we cut back, So there's about 5-6 years of when most of the sterilizations took place here. In 42, there was a lawsuit, finally overturned our law, not on the grounds that eugenics was a bad idea. The judges all still thought it was a good idea to sterilize people. It was overturned on the grounds that there just wasn't due process for the folks, right? They didn't really have a way to get access to a lawyer and file an appeal and that sort of thing. So that was the grounds for overturning it. Anyway, so I can't remember where else I was going to go. I'll let you.
So it was the doctors at these institutions and then the State Board of Health that was making the call on whether these people would be. Right. And they had no way of challenging that at the...
Well, technically they did. It was technically written into the law that you could file an appeal, but how would you actually go about it? Who could really get access to a lawyer? Did the process really happen so fast? It was a matter of days when the check marks were given and you're set to be sterilized, and then whoop, they whisk you off, and that's that. There were also questions about sort of the role of the institutional superintendents, that he was effectively judge, jury, and executioner, right? So it was the superintendent of the institution who made the final decision that a person should be sterilized. But if you wanted to file an appeal of that as the patient, you had to file your appeal to the superintendent of the institution. Right? So there were some questions there, too, that this was not a very fair process for folks. Whereas now, the case law has now evolved in Washington state and other states that anytime there's a question of there should be a surgical sterilization of an individual with a disability, that it has to go through the courts now, right? Your guardian can't just make that decision for you. A judge has to be involved now, and that's because of this long history of making sure we have protections for folks, making sure that if a sterilization is done, nowadays it's in the interests of that individual with the disability. It's not just for the sake of the guardian. It's not for some, the good of society, that sort of thing. It has to be the best thing for the person. So we have a lot more protections now.
So the state, at least this state, Washington State, is still carrying out sterilizations?
Probably, yeah.
And I know there has been some...
But not under the law, right? I mean, individuals who... obviously, there is such a thing as voluntary sterilization, right? And which is another maybe legacy of the eugenics movement, that now, it was actually a struggle for women to get access to voluntary sterilization. And weirdly enough, there's been a flurry of research about this, books published about the history of how women have gotten access to voluntary sterilization. It was basically illegal to get yourself sterilized until the 50s and the 60s. Because, I think that, again, had to do with the eugenics movement, the positive eugenics movement, right? Which said, we want our quote-unquote fit women to keep having babies. So for many decades, hospitals had policies that said, one of them I was reading about was called the 120 rule, where your age times the number of kids you had to be 120 or more. So if you were 40 years old, if you had 30 kids, then you could consent to be sterilized. But if you
30 kids or 3 kids?
3 kids, sorry, yeah. Thank you. 40 times 3, yeah. Or if you were 3 years old and had 40 kids, which is somewhat less likely, yeah. But, yeah, exactly. So it was actually difficult to have a voluntary sterilization. And now, parents and guardians still have concerns about some of their kids with, say, intellectual disabilities and chances of pregnancy or getting somebody pregnant. And maybe there may be, sensible reasons from the perspective of the individual with the disability for having a form of permanent birth control, having a sterilization. But a person with an intellectual disability may, need the guardians to help make that decision or articulate that decision, right? So certainly folks still get sterilized in a sense without their own consent, but you have to go through the courts now. Yeah, we're trying to protect that better. You'll see in the news once in a while cases of, this mother wants her adult son to be sterilized, and there'll be a court case about that. You'll see those once in a while, yeah. So obviously the disability community is still concerned about that issue, right? That there's a possibility of members of the community getting sterilized without that being their own decision. They're also, members of the disability community are also concerned about a legacy of eugenics where state services officers make the assumption that if somebody with a disability has a child, that the person with the disability is automatically not qualified to be a parent, and children might be taken away by social services. And there's a lot of concern. There's research being done by self-advocacy groups about that issue, about what's really happening out there in the medical world and social services. And certainly people have that justified concern that they are so devalued as humans and devalued as potential parents that society frowns upon them having kids, right? I know I was really happy when Emily Rogers spoke about that at the symposium we did in October, right? She works at ARC of Washington State in Olympia and is really a wonderful self-advocate and spokesperson, and spoke, really from her heart about her own feelings about being married and feeling that society and even her friends and family didn't think that she would be an adequate parent as an individual with a disability. So that's another way where, in some senses, past ideas and value judgments about disability still permeate some of our culture. And without even, we haven't even gotten into the eugenics stuff. But I want to keep, touching on the importance of disability as a category here, because I think it's really been neglected in most of the history and most of the thinking about what eugenics was in the past. They usually write about how eugenics targeted non-white people. People of color were seen as the biologically inferior, and women and poor people were seen as biologically inferior. But somehow it boiled down to a category. The unfit was a category that correlated to some extent with the category we now call disability, right? That somehow there was this devalued category, and why we still think that way. We have to keep questioning, why have we always assumed that people with disabilities are people who are not fit to be parents, that disability is simply this biological state or a medical state. I mean, we try now to think of disability not in medical terms, but we're trying to redefine it as a category that's discriminated against. It's a social category, right? It's the way society interacts with you that disables you, right? It's not the fact of using a wheelchair, say that you can't use your legs to walk. That's not the disability. The disability is that society doesn't build ramps so that you can get around everywhere in your wheelchair, right? You're prevented from fully participating in society because of the way the world is built, the way our laws and policies are, the way our social attitudes are that stigmatize you and say you're a lesser human being or even not a human being sometimes is the feeling people have, right? So we got this sort of radical new view of what disability is. That, yeah, people have different bodies, but the difference isn't necessarily a bad thing. Can we think of difference in a more neutral way? And the problem is the way society treats people with disabilities.
And it seems similar to parallels between eugenics and genetics,
right,
where with the Human Genome Project and discovery of, let's say, a particular gene is tied to a particular disease or whatever,
right,
and they say, well, we're looking forward to in the future to just cutting that one out or disabling it or whatever, not recognizing that there could be numerous other things that gene does as well. Right,
right. Or why is the cause of disability always seen as based in the body, genetic? Obviously a lot, if not most, disability is accidental or unknown causation, right? And yet we assume, the power of science, the cultural authority of science and medicine in our world is part of the question here. That's somewhat comparable to the eugenics movement, this assumption that science knows best. Science can do everything. Science can fix everything. Science can control and manage everything about humans and human populations is still out there. That's why I think disability studies is important and powerful for sort of helping us to interrogate, really challenge that continuing authority of science. So certainly there's a lot of connections between that past history of eugenics as a form of genetic determinism and the way we still turn to genetics today and say, yes, genetics causes everything. It's splashed across Time magazine covers, the gay gene and all that kind of stuff. There's a direct link with the history of eugenics as well. Yeah.
Real quickly, did you get a sense, or do you know when Washington State enacted the second sterilization law in, was it 21?
21.
What was the rationale for expanding that?
Right, that we weren't reaching enough people. It was actually across the country, more and more laws were coming into effect in the 1920s. There was a back and forth where laws were perpetually being challenged and repealed, usually like in Washington because there weren't sufficient protections for people. But then a new law would quickly be passed. And we were, again, cutting edge there because 1927 was the famous Buck versus Bell case, where the U.S. Supreme Court upheld the constitutionality of forcibly sterilizing people. So we were, in 21, we were before that. But by 27 and then into the 30s, there's even more and more laws. Yeah. So I think the rationale is to target more and more of the folks in Washington who were institutionalized. And it turned out that of the 700 sterilized, 500 of those were women. And of the 700 sterilized, 400-something were in the mental hospitals, were diagnosed with some form of insanity. And the others were the feeble-minded, the supposed intellectual disability. So they really wanted to expand that range of who they could sterilize, yeah. And
like you mentioned previously, that sterilization law is still on the books?
The first one.
The first one.
The 1909 one. The second one was repealed in 42. Yep.
All right. Well, with that, unfortunately, we're out of time. But if people want to follow this further, they can go to the website that you helped put together?
Yes, eugenics.washington.edu.
Okay, and you had said earlier as well that's going to be getting some updates here and
absolutely
working on the great work that you've done so far. So, all right, with that, we're unfortunately out of time. I want to thank you very much for coming and spending time with us this morning.